somebody told me, well, to work in the ER, you have to kind of callous your feelings because you see some harsh things in the emergency room. You see some sad things in the emergency room. But to be able to do your job and do your job well, you have to callous your feelings a little. And that's true to an extent, but the best nurses are the ones who do feel. The best nurses are the ones who hurt. The best nurses are the ones who cry because they feel it, because it affects them and they have to go back tomorrow because I have to save another person. I have to heal another person.
Today, we are joined by Dr. Rachel Winston. So excited to have Rachel on. This episode and every episode of UNA Talks, we're just sitting with faculty members across the university to talk about their specialties, the things that they're learning, the things that they're teaching, and answering questions that we all have around different subjects. So these are the experts. We're here to talk to them. So Rachel, thanks for being here today.
It's my pleasure.
Rachel is a full professor in the Anderson College of Nursing and Health Professions. You are from Tuskegee, Alabama, which I love. That's so cool. You've been here 13 years, and Rachel is also on the board of education for Florence City Schools. You have 3 children and a husband here in town. You serve on our Disability Support Services Committee. You help accommodate students with a variety of needs, and you specialize in working in the special needs community in the intersection of that with nursing professions. Is that correct?
Correct. All of that is correct.
All right. Well, great conversation. Thanks for being here today. That's all we need to know. No, that's awesome. So many things, and there's so many things we didn't talk about, but just super excited to get to talk to you today, Rachel.
So Rachel, just want to start with your background, how you came into your profession, your specialty, and how you ended up at UNA.
Sure. I'm from Tuskegee, Alabama, which you noted, and I went to school straight out of high school at the University of North Alabama. I got my undergrad nursing degree there. I knew I wanted to be a nurse, so having the opportunity to get that degree so that I can function in the profession that I was interested in worked out great. So my husband and I left Florence, and I worked as a nurse at Huntsville Hospital for several years. We had my son there in Huntsville. His name's Elijah. And then we transitioned back to Florence because we really loved the area. We enjoyed all the options that we had, the river, the community events, First Friday. So we came back here, and I worked here in Florence in this area, in the Tri-Cities area, at J.W. Summers Rehab. And rehab is a really cool place to work because it gave me the opportunity to serve patients who had specific needs so that I can see the benefit of my impact. And what I mean by that is the patients would come in with a stroke or total hip or total knee replacements, and the goal is to get them back to functional before they left my care. So they may stay for a week or 2 weeks, but after that week or 2 weeks, the goal is that they can get back home and function effectively. And I really, really enjoyed that. But in that space is where I realized that one of the parts of nursing that I really enjoyed that moved patients from where they were to where they wanted to be was the education piece. Like, I can help a patient relearn how to move their legs or relearn how to speak, but the biggest part of helping them learn that is teaching them how to do that, teaching them how to maintain it, teaching them how to be motivated. And I didn't just like that piece. I love that piece. So the next question became, well, how do I do that piece all the time?
Right.
So nursing education just made sense.
Yeah.
And lo and behold, I can get a nursing education degree and teach students how to do that, all while I'm teaching patients how to do it. So I decided then to become a nurse educator. So I got another degree, became a nurse educator, and started teaching clinicals. So that's when the nurse or the clinical supervisor takes the students into the hospital and they teach them how to be nurses in the clinical setting. So I did that for several years, but I was a clinical supervisor with UNA. So I went from being a student at UNA to being a clinical supervisor at UNA, and then a couple additional degrees later, I got hired on as full-time faculty at UNA teaching in the nursing program.
When did you receive your doctorate then? When did you find the time to do that?
Oh, you know what? To be honest, I took my time. I paced myself.
Yeah, that's great.
So I worked for several years as a nurse, and then the doctorate, I was already working at UNA as a clinical supervisor, and I did have kids at that time, but UNA did this really cool thing to where if you work at UNA, they will help support you financially in that doctorate degree. And they did not pressure me to get the degree done in 2 years or 4 years. I got to go part-time. So I took my took my time gaining that degree while I was still able to be a full-time parent, a full-time wife, and a full-time faculty member. So I paced myself really well because the industry or the organization that I work for allowed for that space. Like some places, when they say they're family-focused, that was one of the pieces where I could say where I worked really was.
Yeah. Do you feel like that's still true of you? And do you feel like that's true of your teaching experience, that you're able to help your students today sort of maintain their own pace of progression and get the experiences that they want to?
Oh,
You feel like that's still true of you?
For sure. It's very flexible. One of the things that I looked for when I wanted to get my terminal degree, that's my doctorate in nursing practice, was I needed a program that was part-time. I needed a program that was online because I had by then 3 children at home, and I was working. And UNA, in addition to the variety of schools around, but UNA has the same kind of versatility. Our graduate program is 100% online. Our undergrad program is face-to-face, which is the program that I did. It's still available because there's some things you just got to put your hands on. But in addition to that, we have an accelerated nursing program that's hybrid. So the didactic part, that's a fancy way of saying the lecture part, is online because these are students who already have a degree, which is why that program is accelerated. But that face-to-face piece, that hands-on with the patients, that has to be face-to-face. So they do an online piece along with a face-to-face piece, which is the clinical part. So it's easy to meet students, families, mothers, fathers, where they are with the programs that we offer.
Yeah, that's awesome. You were teaching patients how to, relearn or reinterpret like how to move their bodies and like get used to their conditions and rehab, and that is what made you empathetic toward the student experience and made you want to teach. What was the biggest change in that? So you're going from working with patients directly to now working with students and teaching them how to work with patients. What was the biggest shift in that, or maybe what was the biggest surprise that waiting for you in that experience?
Well, as I mentioned, I really enjoyed teaching the patients. One of the things that I learned is it helps if you could work in your strengths. I'm a natural encourager. I'm a natural motivator. So I got to work in my strengths, encouraging the patients to push themselves to meet the goals that they attained for themselves. And I enjoyed the impact that I was having on the patients that I got to see day in and day out, week in and week out, year in and year out. But the more I pondered on what I wanted to do next, because nursing is a very versatile career path. Like you can do a variety of things. You can work with strokes, you can work with babies, you can deliver babies, the whole 9 yards. I began to ask myself, what do I want to do next? How do I want to impact? How can I grow this impact? And the next thought was, well, if I enjoy motivating and teaching patients and I can affect the 5 patients, the 7 patients I have in a day, if I could figure out how I could motivate, impact, teach students, well, each student can have 5, 7 patients a day, 2 patients, wherever they're working. So my impact begins to grow and the benefit to other people is exponential. So the idea, the transition was from affecting the patients I could actually put my hands on to affecting the patients that I plus the 50 students in my class can put their hands on. Exactly. The impact grows, and I thought that was really cool.
Yeah, and have you found that to be, over the years, 13
yeah.
Your notes there, have you found that to be true? Or have you already been able to see the impact of graduates going into that kind of stuff and seeing how they're succeeding?
I have.
Yeah, that's so cool.
I have. Well, students do a really good job of staying connected. Social media makes that easier than it used to be. Yeah. But my youngest daughter has cerebral palsy, so we end up in the hospital for a variety of reasons. And the last time she was in the hospital, the person who took care of us was a student that I taught. And it's so neat for me to be on the tiny couch that's on the other side of the room. Ava's in her hospital bed, and she was doing fine by that time, or doing better by that time. And then the person who walks in the room kind of looks at you out of the corner of her eye, and then she goes back to taking care of your child, and then looks at you again, and then goes back to taking care of your child. And then the last look was like, Dr. Winston? And I said, oh, yes, tell me your name again.
amazing.
Oh, gosh, I remember you. And she was doing a fantastic job. And I
That's
was able to
awesome.
see the compassion, the empathy, the heart that she put in taking care of my kid. So I knew that what I and the other faculty and the other students at UNA poured into this student, it was working because I could see it with my own eyes.
That's amazing.
It was pretty cool.
Oh, that's so cool. I bet you so many professors and instructors and teachers rarely really get that. I mean, that kind of an opportunity is kind of a once in a lifetime. I would imagine. So that's so cool.
It is.
What about how is working with students and teaching and training affected the way you take care of patients and take care of other people? How has that reshaped, sort of your I guess philosophy on that, your approach to that? What are you more empathetic to? What are you more aware of as a result of being a teacher all these years?
I have learned that there is something behind every person. So regardless to if it's a patient, if it's a student, if it's a colleague, there's more to them than what they're showing you in that moment. And to care the way that a good nurse, a good teacher is supposed to care, you have to be able to tap into what's behind what they're showing you in that moment. So the patient may say, well, I'm not hurting, but you can see on their face that they're hurting. So a good nurse has to dig a little deeper and talk about how that person manifests pain, or do they feel like their manifestation of pain is seen as weakness or seen as complaining. Well, if it is, let's talk about that more. Let's figure out how I can serve you well. The same thing is true with a student. Maybe that student is late for class, but is it because they're lazy or just tardy, or is it because they are helping take care, or they're the caregiver for their mother, or they are not your traditional student? They have kids at home that they have to drop off right before they get here. There's a variety of reasons, and it takes a good teacher, not just a teacher, to figure out what's going on behind that so we can address not just what they have to learn today, but what they need to be exceptional. And it's those holistic pieces that make students say things like, Dr. Winston, is that you? Because it is. If I were that teacher that could care less, take the test, do the grade, and get out of here, remember me for what? Or remember me for the worst things. But that wasn't the case.
I think it seems like you in your life have had a crash course in empathy.
I think so.
As a mom of a child with special needs.
For sure.
Which I didn't realize. As an advocate for the special needs community, a nurse, and an instructor, and a teacher. It seems like you are always presented with the opportunity to exhibit a little patience and a little understanding where it's needed.
For sure.
To meet people where they are.
Well, I live it. And
how have you benefited from, in your journey up until now? How have you benefited from empathy and that level of care from others? Who modeled that for you?
Wow, that's a great question.
Who was your Rachel Winston?
I don't think it's cliche when somebody says it was the people who molded me. I've been blessed to have really, really outstanding parents. And then they worked really hard to set me up to be in spaces where people supported me on every side. So I came from a family of 6 kids, so I'm one of 7. So I got to see firsthand parents work really, really hard to ensure that their kids not just had what they needed, but that they had the love and the compassion and the understanding that kids need to be successful. So when we talked about dreams and what I wanted to be, I told you I learned early on that I wanted to be a nurse. So part of their task was to figure out how to get me there. And they did a great job. Not on their own. I had to do scholarships and write essays and the whole 9 yards because school is not free. But to have that engulfed around me and then to come to the University of North Alabama and still have people purposefully supporting me, I learned how to do it from seeing other people do it to me. So then my husband and I started having kids, and we have Elijah and Naya and Ava, my youngest. Ava with her special needs just kind of pulled that out of me even more so. She does require a lot more patience. She does require a lot more understanding. She requires a lot more empathy, because the reality is the CP, the cerebral palsy that she has, limits her mobility. So she's in a wheelchair. It limits her vocalization. She doesn't speak verbally at all. So I have to figure it out. I have to process it. I have to be really patient with her, even when I'm frustrated that I can't give her what I think she needs, because what I think she needs is not actually what she needs. So living around people who sewed into and poured into me was the foundation for me being able to sew into and pour into my kid, which kind of helped me see that it's not just my kid who needs it. It's the student who was late for class. It's this parent who has a special needs kid too, who doesn't have a wonderful husband who is supporting her, who doesn't have a family who's close by supporting them. They need support too. I know, because I needed it to get to where I am. So if they don't have it and I have it, why not share it?
Hey, I hope you're enjoying our interview with Dr. Rachel Winston. I certainly know I am. I wanted to take a short break and thank our sponsor, the University of North Alabama. UNA is a sponsor of this podcast, and all we're really doing on every episode of UNA Talks is sitting with UNA faculty. These faculty not only teach online, but they are also the same faculty that teach in person. So the same people that are speaking with students in person and interacting with our campus community every day are the folks that you get to interact with online as your professor. To learn more about our online programs, I encourage you to go to una.edu/online. You can search all of our programs, learn more about scholarship and different ways to save money on your tuition, and get to know our faculty. You can go to our program pages to learn more in-depth information about those programs. Email the faculty, ask questions with our recruiters. And if you want to learn more about our student success, go to our homepage, read our blog. You can see our press room to see all the things that we're doing in our community. And if you want to take it a step further, follow us on social media. Follow us on Instagram, Facebook, LinkedIn, and of course, YouTube. These are all the ways that you can interact with UNA today. We'd love for you to take the opportunity to do that. And now we will get back to our conversation with Dr. Rachel Winston.
The experience that you had was you were already working with patients with special needs in the special needs community. And then you have a third child.
Mm-hmm.
You already have two,
Yep.
which is a handful. And then you have a third child,
I do.
Ava,
Yes.
with special needs.
Uh-huh.
And she's born with cerebral palsy.
Correct.
So was that what kind of catalyst was that? I'm just really fascinated by that part of your story. That what an alignment there, right? I mean, that you were already sort of, empathetic to this community and individuals with various different needs that they had, and you're like we said earlier, this crash course in empathy that you're getting, and then you have a daughter who needs that care and attention 24 hours a day, 7 days a week. How does that inform what you do even more as a mom?
It does. I think sometimes
right?
it does,
Yeah,
for sure.
sure.
I think sometimes when you have a kid with special needs, people will say this almost cliche kind of statement, well, God chose you for this kid. But I think in our situation, it was obvious that we had the skills, the mindset, the empathy needed, like off the bat, to care for her well. So instead of having a why me, God kind of attitude, it was very, why not me? Like if children like this exist, because they do, and God had to choose who would care for a kid. I mean, if he's doling out cards, I feel like it makes sense for me to get
She
one.
hit the jackpot.
She did, and she's an amazing kid. Like there are there are struggles and frustrations, but gosh, that smile that she has, and the sweet face, and those cheeks that just cry for kisses. She's a cool kid. She really is. And then those pieces that are struggles, based on the life that I've lived and the profession that I chose, I do have those functional pieces to care for her well. Like I do know how to contend with her G-tube because she has one. I do know what to do when she has a seizure. I know how to manage those things. So I don't have to put a whole lot of brain energy on that. I can really just focus on loving her.
Yeah. I was in high school, and friends of mine encouraged me to be a counselor at a camp for children with special needs.
Oh, nice.
And I was, I think, probably a sophomore. So I'm 15 years old and have never had to take care of anybody in my whole life. And I'm with my friends at a summer camp, and our job is to take care of.
Oh, yeah.
We were specifically assigned a boy, and I learned more. I think it was 4 days. And their parents, they drop them off, wave goodbye, and they go, like do stuff maybe with their other children that they're not always able to do, as you can very well understand and empathize with. And they kind of treat it, and the kid gets anything they want for 4 days from a bunch of kids, who are a few years older than them. It's a really cool program, and I learned so much from that time. And what I learned is that there's a different part of your brain. This was just my experience. You're gonna be able to really articulate this. But there's a different part of your brain that lights up, and things that you learn when you're around folks that you learn how to you learn how good you are at communicating without all of the contemporary pieces that you're used to. You learn how you can understand people. You just learn how fast you can do that. I mean, if you're only with somebody for a few days, there's just so much you absorb from them by taking care of them. There's so much that you learn about yourself by taking care of somebody else, by making things not about you, and fully empathizing with somebody's condition. It's incredible the things that it changes your perspective about really everything, and it really changes your perspective on all of your relationships.
Oh, for sure.
I find. And with my very limited experience with that, and then just interactions with family members or friends and their family members with special needs, I've always found that to be remarkably true. So to be able to apply that with your daily profession and all of these other things that you're involved in is really incredible. And then to be able to apply it in your home life.
Oh, yeah.
Just really amazing. So I just think that's amazing.
Yeah, I think to parallel your experience, I mentioned before, Ava's the youngest, so I have 2 older kids.
Right.
And she's a beautiful benefit to have in her home, to have as a child. She's just a cool person. But one of the biggest benefits of just having her and being able to love her and so into her is the benefit to my older 2 children. I can see the empathy being developed in them, the compassion being developed in them, the fact that they're not squeamish at all. Like, they don't get too excited when somebody spits up, when somebody poops, like all the things that, and Ava's 16, by the way. So we're not talking about the baby spit uppy deal on the bib. Like, we're talking about 16-year-old goodies. And they're not moved by that. So when they go into a space where somebody has cerebral palsy or autism, or they're in a wheelchair, or there's some malformation, or you name it, it does not excite them. So it's easy for them to just see them as a person, as a human being, somebody who wants to be spoken to, somebody you can say hi to, somebody whom it's okay to put your hand on. Because why? People enjoy that, unless they tell you otherwise. And they listen well, and they're attentive, and they're watching all the little things. And that's not what I taught. That's what Ava taught them.
Yeah.
Oh, yeah.
Yeah, absolutely. What does this look like, not only the perspective and lessons that we can all learn from that, how do you see this applied to your students who you're instructing around, these principles and how to engage with the special needs community, and really just how do you see this in your actual work here at UNA? How do you see it flesh out in how you teach, and then all of the other sort of extracurricular things that you're doing with like DSS and other organizations?
Oh, for sure. Well, in the same way that I can see the benefits into the young adults that my older children are becoming, it's good stuff. Like, for them to have empathy, compassion, understanding, it's just good. It's just being a good human being. And if I want the nursing students that I'm teaching to be not just nurses, but good nurses, they have to have those soft skills too. Those functional skills, how to start an IV, how to give an IM, intramuscular injection, that's necessary. But to be 100% honest, if you or I or anybody was a patient in the hospital, I expect you to be able to start my IV. I expect you to know where and when to give my IM injection. But when I'm impressed by you, it's when you took the time to look me in my eyes when we were talking. It's when you ask those additional questions to make sure that after I leave the hospital, I can be well taken care of. It's when you make sure that I understand the resources in my community, so I'm not just good while I'm here with you, but I'm good, period. That's when you move from a nurse to a good nurse. And that's what I want to produce as a nursing faculty member. And I got to see firsthand that those traits were in my own 2 older kids from being around this beautiful kid with special needs. So how do I find ways to incorporate that into our nursing curriculum so that our nursing students gain that same benefit? And that was where the respite program came from.
Yeah, so let's talk about the respite program
Sure.
specifically. Where did that, when did that start? What was sort of the maybe defining moment that sort of brought that up? How has the university supported that since its inception?
Sure. Well, as I mentioned, I have this cool kid with special needs. She's 16 years old now. And my husband and I struggled to find somebody to take care of her just for a couple hours so we can go out to dinner, or just for a half a day so the older kids and I, or the older kids, my husband and I, could go do things that just really did not make sense for Ava to do. Like my kids, my older kids like things like theme parks where we're riding on rides. And yes, Ava could go to Six Flags or wherever with us, but the truth is she can't ride those rides. So one of us, I, my husband, or my older son, or my older daughter, would have to sit out while the other three ride a ride. And that doesn't make for the funnest trip at times. So we started having trips where they were specific to Ava, to where we would go places that she would enjoy, and where there were trips that were specific to the older kids. But the issue was when we wanted to do things that were more adventurous that she may not be a good candidate for, finding somebody to babysit this kid with cerebral palsy, who has a seizure disorder, who has to be fed through a G-tube, who is wheelchair bound, who does not speak to you verbally, is not as easy as you might think. So we kind of hunted, we would hunt around in our community to see what resources were available. And there was this program called Break Time. It was led through a church, and this cool guy kind of hosted an evening that was similar to what you described earlier, where parents can come and bring their kid, and they would watch the kid for a couple hours just so you could do things like go out to dinner or just sit and be quiet. It ran, well, we participated in it for a couple of years, and for a litany of reasons, the program ended. And there was not another similar program in our area. And I was working at UNA at the time, so the idea was birthed, how can we build out of that program so the issues that they may have had, we won't have. And a big issue is always volunteers. It was run through a church, so a lot of the people who worked with Break Time were church volunteers. But volunteer means I can come, but if something else happens in my life, I'm not expected to be there. Well, working at UNA, if I have nursing students who need to access these soft skills that you learn from working with children with special needs, it's not hard for me to incorporate it into the curriculum. So it's no longer a volunteer-based program. I have this population of students who are getting clinical hours to learn these soft skills. And that was the key to the ACON HP, the Anderson College of Nursing and Health Professions respite program, because now I have this population of buddies, of nursing students who need to learn how to care for these children, and I have this population of students that will be consistent for the kids to come and buddy with over the course of our once a month respite events. Oh yeah.
How has that program grown? What kind of how much participation is there? I'm just curious to see if it's had a lot of success or.
For sure.
Okay, good.
It is.
Yeah, I didn't know. I haven't heard. Unfortunately, I haven't heard as much about it, and so it's really cool to see where it came from, and curious to know what kind of families or how many families are enjoying the benefits of that in the area.
Oh, sure. So when we first started, and we started about 5 years ago, so around 2020, we started with a handful of families, including my own. So Ava Grace would come, and the way that we recruited kids or we reached out to families is we sent a flyer to our local special education departments in our public schools. And basically the flyer said, hey, this program exists. This is what we offer. We offer an opportunity for your kid to have a fun and engaging evening one-on-one with our nursing students so parents can have a break, so they can just kind of take a step back from the stresses of taking care of a kid with special needs. Now, the caveat was, yes, you can bring your kid with special needs, but you can definitely bring their siblings with you. Because how much of a break is it when you have 3 kids and somebody can watch one, but they're not watching the other 2? So the beauty of the break was that we're going to take all of your kids, and you and your person or you by yourself can do whatever it is that you need to do in this 3 hours, be it grab a bite to eat and go to a movie, be it go to a long dinner. I had one mom who told me she would just go to Walmart and sit in the parking lot because it was quiet. I 100% understood it. So when we started with maybe 7 or 8 families, but that's the child with special needs and their siblings, so that may have been 15 kids. And now 5 years later, we have somewhere between 45 and 55 kids. And we are consistently growing regularly. I was going back through some emails that you sent me recently, and I had 2 emails of just parents who heard about the program. We still market it the same way, so I still reach out to the school systems. And the reason it's just not on blast on social media is I do have a limited number of nursing students, so I couldn't take 200 kids if I only have 50 nursing students. And we do keep our kids, our special needs kids, 1-to-1. If not 2-to-1, if not 3-to-1, because sometimes our kids struggle with elopement, and that's a fancy word for they bolt like lightning. So they come into the nursing building, which is where we host respite, and if they struggle with elopement, if there's a door, they're going to at full speed. So one nursing student may not be enough, because over the course of 3 hours, running behind a kid that's really fast is exhausting. So I may assign 2 students with that kid, because what does that kid want to do? They want to run. Yeah. And if they want to run, we're going to figure out how you can run. So we have partnered with the SRC at UNA. Our kids will go over to the gym, and they will run till their little legs get tired.
Yeah, the SRC is Student Resource, Student Recreation Center.
Yes.
Yeah, so there's a huge gym with all sorts of stuff to do.
Yes, it's like 3 different basketball courts, so they have all this space just to run in circles if that's what they want to do. Ava,
sounds like a good time.
It's amazing. Yeah. Ava's in a wheelchair, and she likes to go fast, believe it or not. So our students grab that chair, and they just run fast right around the courts with her.
Sounds like a good time.
It's wonderful.
Sounds really fun.
It's wonderful. Awesome. So somewhere between 45 and 50 kids, and again, the reason for that is because of the number of nursing students that we have. But we have community members that come and volunteer as well. They serve the food, because what good is it to watch your kids for the evening, and then you still have to get them home and feed them dinner and all the things. No, we give them chicken fingers from Chick-fil-A. I hope I can say that. And pizza, because they love it. Yeah. And if they love it, that's what we'll do. And they like consistency, so there's chicken nuggets and pizza every single time.
And it's a good respite for the families, and I should say it's a good experience for the children, and it sounds like it's a really great experience for the nurses as well. It sounds like they can not only learn a lot and gain a lot from that experience, but it sounds fun. Sounds like it's a really enjoyable
because it is.
I'm sure it's challenging in some ways, but I'm sure it's a great time.
Oh, for sure. They have a blast. Like, the goal is for it to be fun, and they help the kids have fun, but the way that they help the kids have fun is they have fun too. So when it's time to play basketball or badminton or whatever they're playing, the students are playing right along with them. When it's crafting time and they're doing fancy things, the students are working right along with them. But the nurse educator in me also knows that if the student wants to work in pediatrics, these are their patients. But children with special needs don't always stay children. They become adults with special needs. So if you want to work in an ER, these will be your patients. If you want to work in med-surg, I mentioned before, my daughter had a surgery. These will be your patients. These are your patients. So to learn hands-on, not just how to implement an intervention, but how to talk to them, how to get past the walls that they may have up, how to care for them, not just treat them, but care for them. What do they like? What do they not like? The goal, I think, is in part to give our students this arsenal of things that they can try, because there's no one size fits all. So if I give you enough tactics that you have in your arsenal, when you're exposed to a kid with autism who's nonverbal, who doesn't want to be touched, but you have to touch them to treat them, what can you do? Well, we can figure it out at respite, because you're going to come across some kids with autism who have sensory issues, and they don't like the noise, or they don't want to be touched, but we need to get them from the gym back to the nursing building to eat. Well, let's figure it out together. And they're figuring out, the students are figuring out, all under the supervision of nursing faculty and nursing clinical supervisors and community members who do this, who advocate in this, who enjoy this.
Hey again, I hope you're still enjoying this conversation we're having with Dr. Winston. Wanted to take a short minute to again thank UNA for sponsoring this and every episode of UNA Talks. Wanted to encourage you also to go to una.edu/online. UNA's online programs are really exceptional. We have competitive tuition rates and amazing accessible faculty. The same faculty like Dr. Winston who are teaching our students on campus are the same ones that you get to talk to every day online as your instructor. We have a huge variety of programs that will help you move forward in your career, things that can help you personally. So just encourage you to go to una.edu/online to learn more about those. We also have scholarships available, really competitive tuition rates, all those good things that you want to see. And go to the homepage, read more about student success. You can see what we're doing in our community, and follow us on Instagram, Facebook, LinkedIn, and YouTube, of course. So we hope you do that today. And now we will get back to our conversation with Dr. Winston. So we've talked a lot about how the respite program offers this opportunity for our nursing students. Mm-hmm. What is the academic overlap of this, if you will? Like, what about how does this translate into the actual classroom? Not just intangibly, where they're sort of learning all of these things, sort of taking advantage of this opportunity to learn a lot of these things, but how does this actually apply to like curriculum and things like that? How do you grade empathy? How do you grade? I'm in instructional design, so I'm like, what's the rubric here? Like, what are And I'm sure that there's sort of an informal with this program,
sure,
which is just an overlap of so many opportunities, so much amazing alignment and sort of natural gravity around solving a problem for people, but also providing new and exciting opportunities for others. So great. But what does the actual classroom look like whenever it comes to these things? What are the students bringing with them into the classroom? Or I should say, what are they leaving with from the classroom that they're learning here?
Sure. Well, one of the biggest pieces is soft skills. That's what we call it in nursing. And the reality is you can actually test or visually assess a student's ability to incorporate soft skills. And soft skills are those things like your communication skills, your ability to show empathy. Empathy is not just something you feel, though you feel it. You have to be able to show your person, show your patient, show the child that you are empathetic towards their needs. So respite is not there's 50 students there and I am the overseer and I'm kind of trying to watch everybody. Our students are broken up into clinical groups. And in those clinical groups, there's a clinical supervisor who understands the goal of for each student who is participating in the respite program. And one of those big goals is learning those soft skills. Additionally, one of those big goals is increasing your confidence in taking care of this patient population. So the clinical supervisor is very purposefully watching, engaging with, having debriefing discussions with the students to assess what they've learned and to build on the pieces that they could perform more proficiently. So there's a discussion and an evaluation piece that our clinical supervisors are doing all throughout the course. Additionally, we do research on the respite program. So I and several of my nursing faculty peers have surveyed our students to figure out if their confidence level has been increased, how they feel about the soft skills that they've gained. We've done pre and post tests. We've published this research because we would love to see other colleges and universities, be it nursing programs, education programs, because they'll have these kids too, have programs like the respite program, one, because it benefits the community, the parents, the children, the people who advocate for those with special needs, but it benefits your students. You produce better students. So we do research to validate that. So people don't just feel like, hey, we got this cool respite program and it's fun. No, we have the research and the results that show that our students are proficient in these soft skills and they have increased confidence in caring for patients that they won't normally care for. The reality is when you go to a pediatric clinical, for example, in the hospital setting, you may see a lot of RSV, you may see a lot of colic, you name it, but you may see one kid with cerebral palsy on that one day if you went that day. You may see that one kid with a genetic disorder that you've never seen before, that most people have never seen before. But if you come to respite, that kid comes once a month, every month. And you get to understand how this process, how this condition looks, how it breathes, how it moves, and how there's a person behind and in front of this condition. And you're not just taking care of this genetic disorder, you're taking care of this kid. And you can apply that to any patient that you take care of.
Yeah, and it's amazing how, there's a benefit, not only academic benefit to sort of how do we quantify growth in these areas, how do we measure, but there's the, like you said, you published your findings in this. I mean, there's real benefit to the medical community, not only in the world of nursing and in training new nurses and in universities and such, but the medical community gets to benefit from essentially taking care of people in our community. The world can learn a little bit about what that looks like for people with special needs.
That's well said.
Such a great. There's just all of these. I keep saying the word overlap of opportunity, or whatever,
but it is.
Yeah, I mean it's like 50 things coming together to sort of show just how multidisciplined all of these things are and how complicated they are. But yet there is a solution there. And whenever empathy, I think, and opportunity meet, amazing things can happen. So, and someone with your background and your family dynamic that you have with Ava, all of those things kind of coming together. I mean, there's a lot of serendipity happening there.
Agreed.
A lot of really cool things happening that you're capitalizing on super well. What is the key to sort of that transformative experience for a nursing student? Like maybe an example of one would be good. But what do you think is the moment or the lesson learned that seems to turn that light on for a student who's interested in nursing? It goes to the respite program or learns more about how to treat people and care for patients with special needs. What seems to be the thing that flips on the light that either this is something I want to do every day for the rest of my life, or I need to go figure out something else because I don't know that I can enter into this. What seems to be the kill switch for that for people, one way or the other?
First, I do like when students say, Dr. Winston, this is not for me, because it's not for everybody.
You don't want those students. you don't want people going into that like that's a tough gig for you, and it's not the best thing for people who need the care.
Exactly.
Yeah.
And the beauty of nursing is there's a variety of things that they can go in. So I encourage students to figure out what their strength is, figure out what their burden is. And by burden, I mean it's the thing that you see that you're exposed to and you can't not respond to it. Kids with special needs are mine. To see it, it's like, God, well, what can I do? How can I help? What can I give? So I would much rather a student kind of evaluate their strengths and their likes and their dislikes and figure out what their niche item is and go into it. And they figure that out at respite. But I forgot your question that fast.
Yeah, no, I asked a lot of questions in one, so it's not your fault.
Oh, it was the one particular thing.
Yeah, what seems to be the thing that either tells them this is for me or
yes. I ask the students a question, and the question is normally something like, if it were you, how would you want people to take care of you? Often, you'll hear nurses or nursing faculty say, well, if it were your mom, if it were your cousin, if it were your brother, how would you want the nurse to take care of them? But the reality is it could be you. Like if you were not able to speak, how would you want me to address you? If you were not able to walk, how would you want to behave or be helped to behave in this room full of people who are running? And in Ava's example, she wants to run too. So this is me talking to the students, you run because she can't. And you run till you're sweating, because if she could, she would. So if it were you, how would you want somebody? How would you want your nurse? How would you want a nursing student to treat you? And if it were me, it's easy for me to say, if I were to walk in the room and I could not speak, well, then speak to me. I don't have an issue with touch. Put your hand on my shoulder. And if you're not sure, ask me. And look intently at my face to figure out if I like it or if I don't. That's what I want you to do. So the goal is to make it really personal, because it could be you. I told you before, I worked with adults who had strokes. That could be any of us. And strokes can create aphasia. Strokes can create left-sided paralysis or right-sided paralysis. Like that's the person's inability to speak and inability to move their body the way they used to. That could be any of us. And if it is one of us, to ask yourself how you'd want to be treated is not far-fetched.
And that's the nucleus of empathy itself. Is, well, what would you want? Or how would you want to be treated? So it's asking that question in a very real way, and then having the opportunity to respond to it as a student, as somebody who's just learning how formative can that be. I'm sure it's amazing to get to see all the time. What is your hope? I'm trying to think about how I want to ask this kind of last question that I have in my mind, because there's so much cool stuff to think about. What is your hope for your students, or I should say, what is your biggest hope for your students, as it pertains to these specific things that we're talking about today, the respite program, their experience with the respite program? But what would you hope for any nursing student coming from UNA that you get to instruct and that you get to know? If they could sort of take away one thing from their experience at UNA into the world of nursing and into life itself, what would that be for you? What do you think is kind of the most valuable thing they can take away that that you can offer?
I think in part it would be that they are moved by the people they serve. I think that it's what keeps you connected, the fact that it affects you. And I don't know that that's something that a student can be taught, but it is definitely something that a student can be exposed to. It is a process that I can walk a student through, like with them, that I could be with them as they go through that process. Like the goal is for a student to be able to be affected. I worked in the ER for a very, very short amount of time. And somebody told me, well, to work in the ER, you have to kind of callous your feelings, because you see some harsh things in the emergency room. You see some sad things in the emergency room. But to be able to do your job and do your job well, you have to callous your feelings a little. And that's true to an extent, but the best nurses are the ones who do feel. The best nurses are the ones who hurt. The best nurses are the ones who cry because they feel it, because it affects them, and they have to go back tomorrow because I have to save another person. I have to heal another person. I want them to stay affected. I don't want them to callous, because nursing is hard. It's hard work. It's exhausting. You give, and sometimes you don't get a lot back. But if you continue to be affected by the population that burdens you, you will continue to be an amazing nurse throughout your entire career. For me, it started with strokes and knee surgery and hip surgery, but it transitioned into the student population because I am still burdened by these populations of people. I still want to help them. It still hurts me to see them not excelling. And because it hurts me, I keep moving. And so I want the students to be affected deeply, because in that, in being affected lives their passion. And I want them to be passionate about what they do, because in nursing, what you're doing, who you're helping, it's people. So to continue to be passionate about people, to continue to be affected by their pains and their hurts. Yeah, if they can continue to do that, they'll continue to be great.
Very well said. I love that. I love your definition of burden, which is the thing that you are. It seems to be, based on what you said earlier, the thing that you can't help but react to. You can't help but respond to, and anyone truly called to this profession. And I would say the same thing about teachers.
I agree.
I would say the same thing about anyone whose job it is to sit and empathize with people's experience and help them get across the obstacles in their way to some extent, right? I mean, you could almost say that about so many, is that if you're doing it from a place of empathy, it's going to be painful at times and uncomfortable, but your compulsion to help is what drives you forward.
For sure.
So cool to see that in action, and to know that our students are getting that hands-on experience with people who you can only learn certain lessons from folks who are just very different than you.
Agreed.
There's just no other way to learn it. And so cool to see what you're doing. Love to see the impact it has on our community. Love to hear about the impact it has on our students. So, Rachel, thanks so much.
My pleasure.
For your time. This has been such a fun conversation.
Good.
I can't wait to learn more about what we're doing and maybe try to tell that story a little better. Since I don't know about it, I'm sure there's other folks who don't. So maybe we can share a little bit more about the respite program.
That sounds great.
But Thanks to you for joining us today for UNA Talks. This has been Rachel Winston. Thank you so much, Rachel. To learn more about all of our programs, like our College of Nursing programs and our respite program, to learn more about that, you can go to una.edu. It's filled with stories of student success. You can learn all about our academic programs, of course, and learn about what's going on in our campus community. So thanks so much for joining us, and we'll see you soon.